Anesthesia and anesthesia-related care represents those services that CRNAs provide upon request and assignment per the CRNA scope of practice. Education, practice, and research within nurse anesthesia promote competent anesthesia care. CRNAs practice according to expertise, state statutes and regulations, and institutional policies. There are many things CRNAs are responsible for doing. According to the American Association of Nurse Anesthetists, CRNA's scope of practice includes performing and documenting a pre-anesthetic assessment and evaluation of the patient, and developing and implementing an anesthetic plan, initiating the anesthetic technique, selecting, applying, and inserting appropriate non-invasive and invasive monitoring modalities, selecting, obtaining, and administering the anesthetics, and managing a patient's airway and pulmonary status. CRNA's responsibilities also includes discharging the patient from post-anesthesia care and providing post-anesthesia follow-up evaluation, implementing acute and chronic pain management modalities, responding to emergency situations by providing airway management, and administration of emergency fluids and drugs. CRNA's main scope of practice seems long and confusing, but it can be broken down simply. Pre-anesthetic assessment and evaluation includes requesting consultation and diagnostic studies. This includes selecting, obtaining, ordering, and administering pre-anesthetic medications and fluids. CRNAs must also obtain consent for the anesthesia needed for the surgery. Initiating anesthesia technique includes general, regional, local, and sedation. CRNAs have many individual responsibilities which are just as important as their main scope of practice. The American Association of Nurse Anesthetists says the additional responsibilities include administration and management, quality assessment, educational teaching, research, committee appointments, interdepartmental liaison, and clinical and administrative oversight of other departments. The individual responsibilities can also be broken down simply. Scheduling, material, and supply management falls under administration and management. Data collection, reporting mechanism, trending, compliance, committee meetings, and reviews directly deal with quality assessment. CRNA research has to deal with the conduction and participation in departmental and hospital-wide research projects. Finally, respiratory therapy and pain clinics deal with the clinical and administrative oversight. There are other privileges that CRNAs receive. According to the AANA, credentialing, core privileges, and core clinical privileging can be achieved by a qualified CRNA. Credentialing is the recognition of professional and technical competence to verify information and evaluate an applicant requesting privileges. Core privileges are the scope of procedures and activities within a specialty that CRNAs have the experience, education, and competence to perform. This process provides an objective for initial application and renewal of clinical privileges. They are based on education, experience, legal qualifications, and assessment of the individual, says the AANA. The strive for excellence is trying to be achieved by setting such high standards for CRNAs. They are active in many other departments outside of anesthesia. The scope of practice for CRNAs is extremely dynamic, which requires them to be very well-rounded anesthesia providers. Requirements will continue to grow, making the title of CRNA quite an accomplishment if ever achieved. For more information, please visit www.aana.com. Thank you.